It's a pleasure to be here. I must say, they didn't teach me any of this stuff in medical school or residency. And so, like Ed Bennett said that he was talking for 6,000 hospitals. There's about, by some counts, 800,000 physicians in the United States. And so I guess I'm representing them. How many physicians are in the audience? I know Ronnie's over here. Any other physicians? So 3 or 4. Okay, so I'm representing you. And so if I get anything wrong, just let me know. I spend a lot of time talking to medical groups and doctor groups. And the one thing I've always noticed when I'm talking to a big group like this, it's all doctors, is that usually 99% of the people in the audience say, why is he up there talking? I'm a lot smarter than he is. And so physicians are interesting folks. I think one of the things you have to realize about us physicians is we're really into autonomy. Very important. And it's hard for us to usually say, I don't know. And so it's a little overwhelming, all the stuff I'm learning today, and boy, I've learned a lot. And so I think one of the ways that we've been talking about, how do you get physicians to embrace some of these new technologies? And I'm really proud to be the Chief Medical Officer of CareCoach, which Jeff just described, because I think there's a lot of room for us to improve the doctor-patient dialogue, the doctor-patient conversation, and make it so that patients actually do remember the name of their doctor, do remember the name of their diagnosis, and do remember the name of the drugs that they've been prescribed. So with that, I'd like to get started. And all these slides are available, and none of them are interactive or videos or whatever, because I'm old and don't know how to do all that stuff. But what I'd like to do is talk about something Seth talked about this morning is, you're all leaders. And what do leaders do? And I loved what he said was, the only reason that you're not leading is that you haven't done it. And so the only thing leaders do is 4 things. Establish a vision that can inspire yourself and others. Translate that vision into strategies and tactics. Make the assignments to the right people. Hold them accountable. So if we really want to make it so that there's shared decision making, so we decrease per capita cost and increase quality in the United States, we can do it. And if we're leaders, we should be able to do that. And we've learned a lot of stuff here today that can help us do that. First off, the title is How Can You Connect with Doctors? Everybody talks about doctor-only social media sites. And I would say that I was really happy to hear a presentation yesterday by Bruce Grant from Digital's Health Research, where they were talking about why is it that doctors who are the most social people in the world, 3/4 of doctors don't use social media sites at all. And his conclusion yesterday was because these doctor-only media sites haven't really got it right. And just some of the things I learned from him were that basically what doctors are looking for is help with difficult diagnoses, help with how new drugs are being used in their practices, and they need that response in real time. How do these current peer communities such as Sermo or Medscape Connect fail? They fail because they're not easy to use. They fail because they're not relevant to my specialty. Medicine is very hierarchical and very siloed. The content could be better. And one of the biggest problems they have, and some of them, is anonymous posting. If I can't tell if the doctor is a real doctor, if I can't tell where he went to medical school, if I can't tell if he's in my specialty, I'm not going to trust it as much. And having been on some of the websites that are anonymous posting, people really act out when you don't know who they are. On the front page of the New York Times today, there's a great article about, in a small town in the South, how anonymous postings on websites are creating all sorts of problems in a very small town. So I think that's one of the biggest problems. And another big problem with these community-only websites, doctor-only websites, is that they don't integrate into your daily workflow. Ted Eiton, who most of you know is a Kaiser physician in Washington, D.C., great guy, had done some work on Sermo. He went to Sermo, and they had him do a poll. And in the poll that he did, the doctors said, in 5 years, will social media be integral to my practice? 50% said maybe, 35% said absolutely not, 12% said definitely, 100% certainty, only 3%. And he also talked about the anonymous as a real problem in some of these websites. Doctors feel like that they're stretched to the limit by junk work, and then you have this organized medicine versus independent physicians. And what I mean by that, on many of these websites that are doctors only, it seems to me, having not a lot of data, but having spent some time on it, that most of the people there are in small groups, are not in integrated systems, are not really early adopters, And many of them, if you understand how angry they are not real happy with all the changes that we're talking about here. Just to give you some quotes that Ted got from his survey about should we use social media. No, 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 no. These are the answers to your 4 questions. To ensure that patients and their families have an active role in their own health care, they need to make an appointment and keep it. That's an early adopter there. The next one was use Facebook for what? Telling patients they should take their meds and eat right and aim properly so they don't piss on the rim? I'm not their nanny. I'm already sick and tired of patients not taking responsibilities. Patients don't care. Now, obviously, these, I think, are hopefully at one end of the spectrum, but probably not the kind of doctor you'd like to go see. If you actually look on how you should do this, the next speaker is a far more smart guy than I am and far better looking and far younger. And he did a great blog, which I think you all should take a look at. He's not on Sermo. He's not just talking about pills. Remember the law of the few? Look at Scott Monty, who is a real auto guru that I'd never heard of till I read Brian's blog. And the last thing I think is really true. 90% of social media is just showing up. I feel like a fraud being up here. I mean, I'm just a doc that every day gets up and blogs the New York Times, the Wall Street Journal, and a couple times a month write a post. So I don't know why I'm up here. In fact, I think maybe I should just stop and let Brian take over. A couple examples of how social media has helped me. The Grand Junction example, I was supposed to go do a retreat for a hospital, St. Mary's in Colorado. The doctors were not as anxious to do electronic medical record as their hospital administrative staff and board wanted them to do. And they wanted a pre-conference white paper on how to get doctors to embrace health IT. So I sent them a couple, they didn't like them. I sent them another one, they didn't like them. And then I went on Twitter and said, help, send me the great white paper that gets doctors to understand why EMR is so important. Brian Aher, who if you're on Twitter, you probably know, is some kind of chief medical officer or chief IT guy in Oregon. I've never met him, I still haven't met him, but I've talked to him on the phone. He jumped on it, sent me 5 white papers, I sent one, they loved it. So, you know, my organically grown group on Twitter is my research department that does great work for me and I don't pay him anything. I guess I pay him by showing up all the time and doing stuff that he actually uses, and I've talked to him on the phone. And just to complete that story, I tweeted on the Thursday before I went to Colorado, I was gonna go out there, was making my slides, and Bonnie RN sent me a direct message on Twitter and said, I live here, can I pick you up at the airport? So I got off the airplane and there was a woman I've never met before with a sign that said, Dr. Bottles, and she took me to a winery and we had a very nice time, and that's all that happened. So, the Long Branch example, I think, is another one. In Long Branch, New Jersey, I was asked to give another talk like this. It was supposed to be on Monday. The Sunday before, I was called by the organizer that said, we've had someone cancel. Can you be a pinch hitter? Can you come give a talk? I said, sure, I can talk on anything. I said, what's the talk on? They said, well, how should social media be used by patient advocacy groups? Well, you know, about 5 o'clock on Sunday night, I was going, I don't really know a lot about that. So I shouted out on Twitter, help, best practices on patient advocacy groups using social media. And in less than 24 hours, I got 34 responses from all over the world. Maybe some of these smart people here sent me one, and I was able to get enough slides together to fake it through another talk. So, and they actually liked it, and I actually learned a lot. So, I mean, that was kind of interesting. And then I got some stuff that a friend on Twitter gave me some stuff that I get up at 5 a.m. every morning and tweet till about 6 or 6:30. And I gave a talk at 8 in the morning to a pharmaceutical company on leadership where I used some stuff that I got at 5 o'clock that morning on Twitter from a friend. That's just-in-time information. So that's why I think Twitter is so great. How can social media help you connect providers to e-patients? I think it might be the wrong question. And everything I've heard today convinces me this is the wrong question. The right question is that experts like doctors should be on tap, not on top. Recent research has studied in a peer-reviewed journal that physicians are people, or Homo sapiens, and that they should be part of the community, and they know something just like you know something, but they shouldn't be any more important or less important than anybody else in the community. And I really believe that. And that's why I'm very excited about working with carecoach.com and helping to improve the doctor-patient conversation. Now, one of the speakers today, I'm so envious of you guys because you're younger than I am, and it seems like you have a lot more resources because he got a bunch of his friends to go to Reykjavik, and they looked like they were having a lot more fun than I've ever had to figure out the trends of the future of healthcare. Well, I've done the same thing, but the only place I got to go was Starbucks because they have wireless. But these are the trends I think that are probably more important than how you're going to use social media to connect with doctors. Epidermal electronics, we have constant medical monitoring everywhere, and we've heard a little bit about that. Clearly, there's been some VA studies about COPD and CHF where you can decrease the cost of care, and believe me, if we don't decrease the cost of care in America, none of us are going to have jobs. It's the #1 reason why we have a federal budget deficit, and if you want to go to @KentBottles on Twitter, today you'll see that I've just posted a new YouTube video on my series of why healthcare is so important to the economy. We now have NFL teams this year for the first time wearing those little tattoos that monitor all sorts of things, and we've talked about that. We've got lots of people doing that. So the other thing I think that you guys probably know a lot more than I do is captology, the BJ Fogg stuff, which is, I think, so important, is how avatars and computers, how computers are going to change the way we interact and the way that we treat patients. Simulated environments for cyber therapy. If you think about it, it's really incredible that you can have an avatar and then practice if you're a gambling problem. You can practice with your therapist right there with your avatar that then says, you know, how do you deal with your gambling problem? And all the problems I've had to go to a therapist. It's always like a week later I have to explain the problem and everything. This time you could actually just be, you could try it out and practice. I think that's one of the things we haven't thought about is, boy, you could practice by using your avatar to say, well, when you gamble, how do you feel? And if you try this, how do you feel? So simulated cyber therapy, I think, is really great. If you don't know who Joseph Kevdar is, you should. He's at Partners. He really has a lot of important stuff about how we anthropomorphize computers. And if you don't think that computers and robots are going to be part of healthcare, you're wrong. You heard it here first. I'm a doctor. Trust me. Because a couple of studies have just come out where Karen, the virtual coach, which is just an avatar, not a real person, it's just a person on a video screen, Karen has been able to get people who have cardiac rehab to do 3 times the amount of exercise than a control group that didn't have an avatar, a computer to deal with. So Joseph Kevdar, I think, is someone you should take a look at. We've already heard a great discussion about gamification, which I think is huge. I don't know much about it, but why are video games so much more absorbing than my work or school? Well, it's because it's flow, which is how you get into stuff and you lose track of time. It's hard fun, you're learning stuff. It's feedback and encouragement, and it's turning failure not into failure, but you failed because you haven't succeeded. It's because you fail and then you try it again and do better. And there's this word called ferio, which is pride or Italian for, I don't know what it is because I'm too old to be really a gamer, but this is a big deal. So if you want to know about games, and I'm ashamed to say I still read regular books that aren't on a Kindle or anything, but Jane McGonigal, Reality is Broken, fantastic book about gamification by a woman who has a PhD in games, and Tom Chatfield's Fun is Incorporated, and then Kiosk is a great company that's trying to use gamification theory to get you to be well and to do a better job. The Quantified Self movement, you all know a lot more than I do. Another shameless plug for carecoach.com, and in your bag is something that you all should take and sign on to carecoach.com, and then cell phone apps. So what do leaders do? You're a leader. Whether you're a patient, whether you are just a person, you're a leader. And what you should be doing and what I should be doing is establishing a vision that can inspire others. And if you're not inspired by what's happened today, you better come see me as a doctor because you got a problem. There's a lot of great solutions out there that we can use. Translate that vision into strategies and tactics. Make the assignments to the right people. Hold those people accountable. So I'm holding all of you accountable to better the doctor-patient relationship and to use patients as a resource because we really haven't done a good job as physicians and as a medical system of using a very valuable resource, which is patients and what they've learned about their bodies, what they've learned about their disease. With that, I quit, and I turn it back over to our moderator so that you can hear someone that knows a lot more than I do about this stuff, Brian.
Thank you.